I've had people come to me who've had the disease for many years and still had significant symptoms or had side effects from their treatments. One of the questions people with myasthenia gravis should ask their doctors about their treatment is, what are the side effects I might expect with this treatment? The treatment of myasthenia always involves balancing risks and benefits. Because myasthenia gravis is an autoimmune disease and most of the treatments that are used for it are going to suppress your immune system, there is a risk of having an increased rate of infections with most of the medications that are used. Another question that people with myasthenia should ask their doctors is, are the side effects of this treatment worth the beneficial effects that I'm receiving from it? All of the medications that are used to treat myasthenia do have potential side effects, but the benefits of the medication, namely decreasing the symptoms of the disease, also have to be taken into effect. And when someone has very severe disease, then you may be more tolerant of a higher risk of side effects. Whereas if someone has more mild disease, then you wouldn't really want to use a medication that has a higher risk of side effects. So it's always a balance of risks and benefits when you're talking about medications for myasthenia. Another question is, am I a candidate for thymectomy or a surgical removal of the thymus gland? It's pretty clear, and there's a pretty good consensus that people with myasthenia who are over 60 or so do not benefit from thymectomy. But when I have a young patient under 60 years old whose symptoms started within 2 or 3 years, I usually will recommend that they have the surgery to remove their thymus, because the chance that they go into a medication-free remission in the future is higher. For people newly diagnosed with myasthenia gravis, I would tell them not to worry, that there are many different treatment options for this disease. It's a very treatable disease. It may take some time. It often takes some tinkering with medications and some adjustments in your day-to-day life and schedule, but eventually you'll get to a place where you're able to do almost everything that you want to do and that you were able to do before.